watching NBC4 New York, the Tri-State News Channel. And now, Jane Hansen, Maurice Dubois, Chris Cimino, and Otis Livingston. This is News Channel 4 Today in New York.
Just ahead this morning, a faster facelift with less scarring. Dr. Smith continues his series and shows us how it all works when Today in New York comes right back. Well, facelifts have come a long way in the world of cosmetic surgery.
And today, Dr. Ian Smith continues his look at the newest procedures. This time, it's those that leave less scars, heal a lot quicker.
That's right. This is what every woman has been waiting for. It's easier, it's a better result. Good morning, Jane and Maurice. Good morning, everyone. Now for the last, but definitely not least installment of our plastic surgery series, facelifts. But not the traditional lift that pulls the face back and makes you look like you're stuck in a wind tunnel. This surgery hides the scar, and it gives the face a more natural appearance.
I think you're a good candidate for this operation.
Final discussions for Nancy before she undergoes her facelift.
I want my chin line here to look better, okay? Hopefully to smooth out the skin line. Also the neck is very important as you get older. I want the kind of the puckers here to go away.
Are there any particular questions that you have?
New York plastic surgeon Dr. Darrick Antell says these are the two most common areas of concern for people considering a facelift. And one of the hottest trends in fixing these problem areas is something called the short scar facelift.
Well, the shorter incision is a real plus for the patient. It's much less visible. It's very ponytail friendly if they like to wear their hair back. It minimizes any incision behind the ear, sometimes completely eliminating the incision altogether.
In the older facelift, the incision typically ran down the hairline, underneath and then behind the ear, stretching back behind the head. But now doctors eliminate the extended cut behind the ear, either keeping it mostly along the front hairline, as in this case, or even extending it up in front, depending on the shape of the hairline. But in both cases, eliminating that behind the ear scar. And doctors can deliver a more natural result.
In the early operation, people just brought the skin back and it tended to give that wind tunnel look. By working on the deeper layers, we can reposition the underlying fat and the actual muscles so that everything comes up and looks much more natural, and it takes tension off of the skin.
Like many other procedures, the short scar surgery can be performed right in the doctor's office. Same sterilization techniques, same safety precautions of bigger hospital operating rooms. Many patients, in fact, feel more comfortable and can be monitored more closely without distractions. The key, says Nancy, is doing your homework first to find the best doctor.
You want to go to the best possible one you can. You have only one face. You can scrimp on other things, go to thrift shops, you know, but not with this doctor, no.
Now, Nancy's surgery lasts a little more than a couple of hours. After these procedures, the face will be swollen and a little bruised. But in about 10 to 14 days, most people will start to show off their new look. And remember, these cosmetic procedures are rarely, if ever, covered by health insurance. So make sure you save up before signing up. Of course, for more information about our series, just log on to www.wnbc.com/tiny for Today in New York. Once again, wnbc.com/tiny.
So it's 2 weeks, 10 to 14 days versus what? The regular facelift is a month or more?
Well, it's about 3 weeks. I mean, it's a little faster, you know, because you're doing less. But the beauty of this really is that they're actually working underneath the layers of the skin. So, you know, the wind tunnel we talk about, people are like, ah. Yeah. But with this, if you take the inner layer of the skin and move it up, then it all goes up very nicely.
Well, there you go.
Maurice, I see you're very interested.
I'm on the edge of my seat.
Thank you.
Well, there's our plastic surgery series.
Thank you very much.
Okay, guys.